I have just washed my hands and I'm going to expose the woman. We are going to perform abdominal examination. She has emptied her bladder. Remember, ensure that the woman's bladder is empty to avoid any discomfort that could be brought about by a full bladder. There is a pillow under her flexed knees. So first of all, we are going to ascertain the gestational age of the woman so that we can compare the abdomen with her gestational age. And then after that, the first step of abdominal examination is inspection. In inspection, we are going to inspect the size of the abdomen. Our abdomen looks big when compared to the gestational age. They are both equivalent. It's not too big nor too small. And the lie is longitudinal. The contour is smooth. As you can see, the abdomen, it's not saucer shaped. It runs smoothly from the fundus to the pelvic area. There is also no striae gravidarum. The linea nigra is present. There are no scars. Yes, because she has not given birth. She is graph 1, so there are no possibilities of cesarean section. And also, during history taking, she said there is no history of any surgical procedures. And like I have said, there are no our abdomen looks normal. There is also no fetal movements on observation. And when I also look at the abdomen, it does not look like there is polyhydramnios anywhere. I'll confirm it as I do the palpation. From there, we are going to do fungal palpation. On fungal palpation, we are assessing which part of the fetus that is lying on the upper pole of the uterus, which is the fundus. And as I palpate with the pads of my fingers, I can feel a round, hard part, which could be the fetal head. So in this case, possibly we can suspect breech. From there, we are going to measure the symphysiofungal height. Symphysiofungal height, we are going to measure from the symphysis pubis, the upper border of the symphysis pubis, with our tape on the inches facing up to the upper border of the symphysis of the fundus. And then let's see, it's about 42 centimeters. From there, we are going to the next step, which is lateral palpation. My non-dominant hand is going to support as I palpate with the dominant hand. Remember, you are using your finger pads, not the tips, and I can feel a hard, smooth area that is continuous on this side. And then from here, I can feel some dimples with some protrusions, which could indicate the fetal limbs. And then I'm going to tend to do pelvic palpation to determine the fetal parts that could be lying at the pelvic rim. There is also a maneuver that is called colic grip, which is used to determine the engagement. That part of the fetus which is lying at the pelvic rim, if engagement has occurred, your pelvic grip will help you to determine how much of that area has entered the pelvic rim. And in this case, the fetal body is still it's still balloty. Remember, I said I felt the hard part of the fundus, and in this case, there's a soft area at the pelvis, which could be the buttocks. It has not yet engaged. From there, we move to auscultation. And with auscultation, we are going to auscultate the fetal heart, and we are going to put our fetoscope on that area which felt a bit smooth and running continuously. And in this case, it is on the left side. Our fetoscope should be at 90 degrees with the maternal abdomen, and we compare it with the maternal pulse, and we listen for 1 minute. And as you listen for 1 minute, You will be also trying to note any odor that could be coming from the genital area of the mother. After listening for 1 minute, you ensure that your client is comfortable, you cover the client, and you ask her to lie on left lateral side, and then you wash your hands. After washing your hands, you inform the client about the findings and you document.